Thanks for joining us today. I want to talk to you about migraine headaches today, Dr. Butler. Would that be okay?
Sure. Yeah.
And I think a lot of people today suffer from those. We have a lot of things that can go on in our environment. I know in chiropractic can be thoughts, traumas, or toxins, but that's really all the things that can create a subluxation, correct?
True.
True. So
Yeah.
we'd be in probably a lot of those were thoughts. But how does that show up in terms of migraines? I mean, people can come in with diagnosis of migraines. Now they're doing something that I understand why people do it because they're trying to get out of pain, but they're actually injecting Botox, so a neurotoxin into the base of the skull, just to
Seems
deal with
counterproductive
migraines.
to me.
It does
That's
to me
treating
too.
an effect. You want to treat
Yeah.
the cause. The cause of the migraine is nerve system function isn't right. That's what initially started the migraine in the first place. So you have to deal with it on that level, and there's not a quick fix for that. But if you enhance nerve system function, then the migraine will reduce. I've seen it. I see it all the time in the office. We treat lots of people with migraines, and what I've found the best way to treat it is with adjustments in certain parts, and usually it's neck. Really good neck adjustments will reduce the migraines the majority of the time. I can honestly say that.
So majority of the
we
time,
have
do you
great
find it in
results.
the upper cervical area?
Yeah, it's usually upper cervical related, because that's where the brainstem is, and there's a lot going on there. And so interference with nerve system function there is going to cause problems, which can manifest as migraine. That's one of the things that can happen. So if you treat that, then the migraine gets better. That's it really.
Have you, now, you know, some people, I know it's very common in women, they'll diagnose migraines as hormonal. Is that,
Hormone is an effect, so you want to go to the cause there.
so
We'll go
the
back to the cause.
cascade of hormones is still based on neurology communicating to the
Yeah,
body.
something's out of whack, something's out of balance. If the hormones are too high or too low, that's still an effect, it's not a cause. So you want to find the cause of why the hormones are doing that. They aren't doing that on their own. They're being driven by some kind of information, directions, and that's coming from nerve system. So treat nerve system to enhance it, and that's going to get better. There's no denying it. We see it all the time at the office.
You know, it's interesting. I think a lot of people think of chiropractic as somebody who just moves bones, but that's not really the philosophy or the basis of chiropractic, is it? That's just a technique
Yeah, it's
to
one
work
technique.
with freeing up
That's the way we do it.
the neural.
A lot of times moving bones is a basic way of putting it. It's kind of mechanical, but yeah.
But I
there's
think
more
people
to
have a
it than that.
misconception of chiropractic. I think we put it in too much of a box, don't you think?
Sometimes. They're getting more open to it, though.
They're getting more open?
Yeah.
Because I know that, a lot of people will go down the path of going to a neurologist for their migraines versus thinking first about maybe seeking out a chiropractor.
The difference in philosophy, the basic difference between medical model and the chiropractic model is chiropractic believes that the answers come from within as far as treat nerve system and everything else gets better. The body knows how to take care of itself better than anything else. I mean, if that wasn't the case, a cut would never heal, but it does, whether you have medicine or not.
It's true.
And so it knows how to take care of itself. It just needs to be free to do that. And so a good chiropractor helps make that happen. And a neurologist is going to look at a symptom or a diagnosis and treat that effect.
I know from having worked with friends and family with migraine histories that I would say there are some who are gifted at that in the chiropractic field, and some who
Migraines can be
maybe.
a challenging thing to fix sometimes. Yeah.
What do you find if there's a? I guess everybody's unique,
A
but
good technician.
yeah, what
Somebody
is
that's good at
one of the
adjustments.
most common things that you find with somebody who has a migraine?
Upper cervical subluxation, misalignment of the spine at the upper level or by the brainstem. So you want to find somebody that can actually remove the interference there and that's good at it. If it was me, if I was having migraines and I was somewhere and I can't go to me, so I'd have to find somebody else, right?
Right.
But I would want to find somebody that's good at technique, has a reputation of being able to reduce symptoms. Classically, I prefer it that way. You know,
So, and when you say
hands-on.
is it hands-on working occiput, atlas,
Yeah, upper
axis,
upper
those,
neck
those
area.
areas? How would I go about? So let's say I'm not here in Denver where I can go see Dr. Butler, but I live in Kansas City,
Yeah.
right? Or I'm up in Billings, Montana, or I'm in
I
London.
guess you'd have to look on Google or online to see who's good at adjusting, and then you'd have to call them and ask them, you know, have you treated migraines before? Do you know how to do occipital adjustments? That's a good one.
Yes.
And occipital adjustments really help. Not every chiropractor can do that, and I think that is real effective with migraines. Yeah.
Because it's a very unique adjustment, the occipital
It is.
area.
It is.
Yeah.
It's specialized. Yeah.
It's interesting, so a lot of people think that the skull doesn't actually move, but what you're basically saying is that the skull itself can move, so it's not just about C1 through C7.
It's the relationship between the skull and the upper bones at the top of the neck, where they come together, all that. Sometimes that stuff gets, the relationship isn't right.
Torqued
So,
or...
so what I say is it's like a pumpkin on a broomstick, you know, and if the pumpkin gets off center there on top of the broomstick,
Mm-hmm.
you know, I mean, I think anybody can understand that that would cause interference with things happening.
Yeah, because everything does come
Yeah.
out from the brain right through
Yeah,
that
that's
area.
how it all works. So you have to recenter that, and to do that, that's I call that an occipital adjustment. It's a little different than a standard neck adjustment. So yeah, so you want to find somebody that could do that probably.
So that's
Do
probably
it
why
well.
I take it you probably see a lot of people who come to you because they've been referred for headaches,
Mm-hmm.
headache
On
patterns.
yeah, we do see a lot of that.
And then besides relieving that, are you able to, because of doing that, work with them so that they can begin to build new communication patterns in the body and break that pattern of
Sometimes
migraine cycle?
Yeah, the ones, some of them have had the migraines for longer than others, and so the patterns are more ingrained. Others you can retrain it. I call it remodeling, because that's kind of what you're doing, remodeling stuff. And just like in any project, some remodeling projects are easy, some of them are more involved, you know?
Do you tend to find it's the length of the dysfunction or the primary
it's such an
cause?
art. There's so much to it, like it's not that easy to define.
Okay.
You know, some people have mild migraines for 20 years.
So they're functional.
3-4 times a month. Other people have serious migraines once every 3 or 4 months. It's hard to say. The one thing we know is if we adjust certain parts, the migraines reduce and they get better. I think we can say that and be safe.
Wonderful.
Yeah.
Well, I can see why you end up with a lot of patients coming to your
Yeah.
practice and getting referred for headaches. Well, wonderful. Thank you for your time. I appreciate that today. I look forward to coming into your practice. I think we're going to do a series with you then
Yeah, that'd be
around specific health issues from high blood pressure to, as we talked about a little earlier, easy in pregnancy.
Pregnancy, Bell's palsy, carpal tunnel syndrome, rotator cuff, rib out of place. I do a lot of that too.
That's wonderful. Well, I look forward to following you up in your practice.
Yeah, thanks.